Imagine that Kaylee suddenly collapses on the floor, and upon rushing to her side to assess the situation, you realize that she's not breathing and her heart is not beating. What do? Do you panic? The correct answer to the situation is CPR, cardiopulmonary resuscitation. It dates all the way back to the year 1740, and according to www.heart.org. Yet even today, most Americans don't know how to perform CPR. I, as a nursing student, am being trained in CPR, and am here to give you a quick lesson in it. When given properly and immediately to cardiac arrest victims, CPR can save lives. Statistics show that the earlier CPR is started, the greater the chances of survival. In fact, the American Heart Association estimates 100,000 to 200,000 lives of adults and children could be saved if CPR is done correctly and early enough. Did you know that according to the American Heart Association, over 1.5 million heart attacks occur each year, and approximately 350,000 of those people die before they ever reach the hospital? CPR is not just for heart attacks, however. According to the American Heart Association and the American Red Cross, approximately 7 million adults and children suffer disabling injuries in their own homes each year, in accidents that may or may not require CPR. Some of these accidents include electric shock, drowning, severe allergic reactions, choking, drug overdose, and suffocation. No family can rely on 911 alone. When someone stops breathing or their heart stops beating, they can only survive for 4 to 6 minutes before the lack of oxygen damages their brain or they die. This is where CPR comes in handy. CPR helps maintain the blood flow to the heart and to the brain, and each compression, when done properly, acts as the person's own heartbeat. So how do you do CPR? Well, according to the American National Red Cross, the first thing you do is check to see if the person's responsive. Can he or she answer simple questions? Ask them their date, their birthday, their name. If they can't answer those questions, then they're not responding properly. And is the person breathing normally? Is their chest rising? Can they talk? If the person is not responsive or not breathing normally, call 911 immediately. If possible, do not leave the victim alone. If the victim is still not breathing normally, this is when you begin what my nursing professor, Dr. McDermott, calls Operation Pump and Blow, chest compressions. Hand positioning is extremely important when doing these chest compressions. Kneel next to the victim and find the notch at the tip of the breastbone where the lower ribs meet the sternum or chest. This is called the xiphoid process. If you push directly onto this notch, you will puncture the victim's liver. You don't want to do this. Now place your middle finger on this notch and your index finger next to your middle finger. That way you are at least 2 fingers away from the xiphoid process. Next, place the heel of your hand on the victim's sternum near your index finger. Place your other hand directly on top and interlace your fingers. Straighten your arms and lock your elbows. Your shoulders should be directly over your hands. When doing compressions, you should push the sternum down 1.5 to 2 inches. If you hear a sudden popping or crunching sound when doing these chest compressions, do not be alarmed. In the course of CPR, the victim's ribs are almost always broken. If you hear this sound, you aren't doing anything wrong. Pump the victim's chest as hard and as fast as you can to imitate the heartbeat, and do this 30 times. Each thrust down on the victim's chest is 1 time. Be sure to count these out loud. 1, 2, 3, 4, 5. After 30 compressions, tilt the person's head back and lift their chin. Pinch their nose and cover their mouth with yours and blow until you see their chest rise. Do this 2 times. Each breath should take 1 second. Now, there are forms of CPR that you don't do the breathing with, but the procedure for that's different. Only stop CPR if another trained person takes over CPR for you, if more advanced medical personnel take over, if the scene becomes unsafe, or if the victim's heart starts beating. There are situations where if you're just an innocent bystander doing CPR on somebody in the event of an accident, you will ride along with them in the ambulance and not stop chest compressions until you get to the hospital. Now keep in mind that this method is only done for adult victims. Other methods are practiced in the event that a child, ages 1 to 8 years old, or an infant less than 1 year old, is the victim. These differences usually include how far you push their chest in. And with the infant, you use 2 fingers instead of both of your hands. You can receive formal CPR lessons and certification at a hospital or through the Fire Ambulance Association near you. This formal training could someday help you save someone's life. Please remember that this speech is only intended to inform you and serve as a guideline for learning about CPR. It is not intended to be a replacement for formal CPR lessons or course. A nice thing about the formal CPR lessons is called the Good Samaritan Law, in which case if the victim doesn't survive if you're doing CPR, or if you do break the victim's ribs, they can't sue you and no harm is done for you because you were just the Good Samaritan passing by helping. If you are interested in taking a CPR course, please contact the American Heart Association at 1-800-AHA-USA-1 or the American Red Cross in your area. Also, never practice CPR on another breathing person. If doing so, injury may occur.